going to look at the LMWH, which is nothing but the low molecular weight heparin. So beginning with some questions, the first question we want to ask is what is the bioavailability of this, and the second one is what about comment on the monitoring of the LMWH. So in this video we'll find the answers to these questions and learn in detail about this topic. So to start with the LMWH, what is the structure? So structure, if you see, it is a glycosaminoglycans. It is a glycosaminoglycan. It is a glycosaminoglycan. And what does it contains? It consists of the short. It consists of the short saccharide chains. So it consists of the short saccharide chains. And what about the factor 10A inhibitors? So the factor 10A inhibition. So this answer is yes, it is present. And next when we see the factor 2A, the factor 2A. So the factor 2A inhibition. So the factor 2A inhibition is, again, the answer is yes. So this is nothing but the 10A is greater than the 2A. And what does this LMWH do? So this LMWH, it contains a mixture of the long and the short chain. So it's nothing but a mixture of the long as well as the short chain. And what about the bioavailability? So looking at the bioavailability of the LMWH, the bioavailability is nothing but it is oral. Compared to oral, it is not absorbed. And when we look at the subcutaneous, it is nothing but it is good. Then when we look at the metabolism, so how is the metabolism of the LMWH? The metabolism is that it is cleared by the kidneys. It is cleared by the kidneys. And then when we look at the safety in case of the renal disease, so what about the renal disease? So in terms of the renal disease, it is used with a close monitoring. There is a close monitoring. So it is used by a close monitoring. And then what about the monitoring aspect? So do we monitor it? So the thing is, it is monitored in case of the renal impairment. So it is monitored in case of the renal impairment and with a anti-factor 10A assay. The anti-factor. So anti-factor 10A assay. Then when we look at the protamine sulfate as antidote. So when we look at the protamine sulfate as protamine sulfate, so the protamine sulfate as the antidote. So in this aspect, it is nothing but this partial reversal. There is partial reversal, and it acts only on the longer chain. So it acts on the longer chains. And what about the risk of the heparin-induced thrombocytopenia? Risk of the heparin-induced thrombocytopenia. So here the answer is it is low. Then what about the risk of the osteoporosis? Osteoporosis, here again it is low. Now we'll go back to answering our question. So the first question we asked was what is the bioavailability in terms of the LMWH? So the bioavailability. So if you look at the bioavailability, it is nothing but the bioavailability, it is in case of oral. In case of oral, it is nothing but it is not absorbed. Then when we look at the subcutaneous type, in case of subcutaneous, the answer is it is good. Then we move on to the monitoring. So how is it monitored, or should it be monitored? So the monitored is required. Yes, it is required. And in case of the renal impairment, that is a kidney impairment, with the anti-factor 10A assay. With the anti-factor 10A assay. So this was about the LMWH, and to grow daily, please do subscribe.